Hello, everybody. Welcome to the Trikafta Experiences Keeping It Real World session of ResearchCon. My name is Trey LaRosa, and I will be moderating this session with my co-host, Aaron. We'll go ahead and get through some logistics before we get started. Just want to make sure everyone knows, talk about some of the technology and stuff. So first, the disclosure: to advance drug development and search for a cure, the CF Foundation has contracts with several companies and has received or may receive milestone-based payments, equity interests, royalties, or the net sales of therapies and or other forms of consideration. Resulting revenue received by CFF is used in support of our mission. More information about our model is available at cff.org/industry. Some logistics. The session is being recorded. Viewers will be notified by email when recordings are available. Closed captioning is also available. Move your cursor over the video feed and click the CC icon that pops up. To engage in the chat for the session, please comment in the stage tab on the right side of your screen. Please feel free to submit any questions at any time in the Q&A box. The chat will also be monitored in case questions are asked there as well. When submitting questions, ensure you are in the stage tab. The final 20 minutes of the session are reserved to address as many questions as possible in the order they are received. We need to make it clear that questions about individual diagnoses or treatment plans cannot be addressed. If possible, just to help with the moderating of the questions, please address the question to the speaker you would like to answer. Otherwise, we will decide who is most appropriate to answer a given question. If it's more of a general question, then we can just sort of decide. But yes, if it's specifically related to something me, Aaron, or two of our presenters say, please make sure to let us know. There will also be some polls throughout this session to invite the audience to participate. These polls can be found on the right side of your screen under the tab Mentimeter, where you will be asked to answer. So we went ahead and created a little graphic to show that and hopefully make it a little bit easier for audience participation. So the agenda for this session, the first couple minutes, which we're doing right now, is the introduction and the overview of the session. And then the first session will have Dave Nichols, Dr. Nichols, present on some of the evidence of the positives and the amazing robust benefits we've seen of Trikafta, and I'll also share my positive experiences having been on Trikafta and seen significant benefit. And then the second half of the session will be an honest conversation as well about the negatives that we've seen, with a presentation from pharmacist Johnny Grant and Erin Kunzen, who will be sharing some of her experiences on the negative. And then the last 20 minutes will be reserved for Q&A and further discussion. So just a quick about the background on the hosts. My name is Trey LaRosa. I'm 27 years old. I was diagnosed via sweat test as an infant. I'm a scientist, writer, and a consultant. And I'm a father of this beautiful mini golden retriever, Duncan. He's not really a mini golden retriever. He's a golden retriever mixed with basset hound. And he is my best friend. I have a bachelor's in chemistry with minors in math and biology, and I went to the University of Kentucky. And if we have any college basketball fans, let's not talk about the tournament. I'm an avid reader. I say I'm a surfer. I've not gotten a lot of waves, but I've surfed a couple times. But I love surfing. I'm a skier, hiker, and a prolific taker-upper of hobbies. Delta F 580 homozygote, began Trikafta in November of 2019. I've been very stable since. I'm currently living in the DC area, and I'm originally from Kentucky. And I'll talk about this a little bit more during my portion of the session, but I also have my sister passed away from CF, from chronic rejection about 4 years ago. And then, I'll just, my family is very, very important to me. There's some of these photos up here are my sister, and my sister had a much different experience with CF than I've had, and I've been very, very privileged in that regard. But because of her experiences, it's given me a lot of context and understanding as the full spectrum of CF experiences, especially differences in gender, as well as transplant care and things like that. So my sister's story, she was a devoted advocate, is very, very important to me to share and continue living on in her honor. My parents are incredibly important to me as well. As you can see, there's some photos. There's one of my favorite photos in the top is this photo of my dad when Alyssa was a baby, and someone hung a sign on him that says, "Don't bother me. I'm worrying about Alyssa." That photo, when I saw it, was just mind blowing to me. And just a little bit about me. I really am very advocacy is very important to me, and sharing people's story and working to build a better world for everybody with CF, whether or not you're on modulator, whether or not you live in the U.S., no matter racial, gender, ethnic boundaries or breakdowns, anything, all of that. It's very important to me to continue advocating for a better world. So just a couple photos of some advocacy stuff. So I'll go ahead and pass it to Erin so she can talk about herself a little bit.
Hi, everybody. I'm Erin Kunzen. I'm 39, and I was diagnosed with CF at 9 months old after being diagnosed with failure to thrive. My mutations are both rare. They are G85E and S1196X. I was on Trikafta from January 2021 until August of 2021. I was actually approved through Vertex's study on rare mutations in the lab with Trikafta. Approval was based on a 10% approval rate, and that so I was fortunate enough that I had a response in the lab. I'm from Northeastern Ohio. My husband Brian and I have been married for 15 years. I come from a large family. I'm the oldest of 5, but I am the only one with CF. I have a BA in sociology with a concentration in criminology from Cleveland State. And we have 2 cats, Nix and Nova. They keep us entertained daily. And to pass time, I love doing diamond paintings, reading, and watching the craziest documentaries and reality TV that I could possibly find. You can switch slides, Trey. This is my family and some of my friends, and I'm a proud aunt. And these are all the special people in my life that have been there for me and made me who I am. So I'm looking forward to discussing more about my CF experience and what that meant for Trikafta. I'll give it back to you, Trey.
Thank you, Erin. And you all will be hearing more from Erin after Dave's presentation. So one more thing before we do this quick poll, I want to also say if you have any technology problems during the session, the help desk is available in the Expo tab on the left side of your screen. CF Foundation IT support are there to help you if you are having any trouble during the event. So let's go ahead and do our first poll. We have 4 questions. And remember, you're answering this using the Mentimeter tab to the right of your screen. The first question is, what is your connection to CF? Second question, how old are you, or how old is your child or loved one CF? If there are multiple, you can choose more than one age. Are you currently taking a modulator? If so, which one? And then please share any positives or benefits you have experienced while taking Trikafta, if applicable. Okay, we've got 5 people with CF in the session, and we've got 6 now. Polls are, I see, questions are still coming in. Okay. Then we've got 4 parents. We've got 1 caregiver. We've got an immediate family members. And we've got 4 researchers. Okay, very cool. We've got someone who works at a CF care center and 3 others. Okay, awesome. Thank you all. Still got some coming in. See, someone says they're having issues, polls not coming up.
There is a polls tab next to Mentimeter.
I see, and they're supposed to be in the Mentimeter. So if you're seeing no polls come up, check and see if you're in the polls tab or the Mentimeter tab. Got people who have some loved ones that are under 10, some people in their teens, in their 20s, some in their 30s, 40s, 50s. Awesome. So it's a nice bell curve. It's really cool to see the like have an idea of who we're presenting to. So I like this. This is very cool. I hope everyone's been enjoying ResearchCon. This is, I think this is the 4th year, but this is an awesome event every year, and I think it's an incredible opportunity to see a lot of really fascinating different sessions. Awesome. Got a lot of different ages. Awesome. Yeah, I'm curious about this, especially. We could ask. I wish we could ask a bunch of questions. I'd love to know what mutations people have and stuff too. Interesting. Wow, all Trikafta or not at all as of now. I think that number in the bottom right is how many people have answered, 22. So very cool. Awesome. Okay. So we can come back to this one a little bit later so that we can make sure to keep it going. I think I can. Yeah, we will review those, but we just want to make sure we're being on pace with time. So I think we are going to be switching to Dave's presentation here shortly. Dr. Nichols is a CF researcher who has been very involved in Trikafta and other modulator research, and Dave is just wonderful and an incredibly amazing researcher who is just doing just outstanding work. So I'm really looking forward to his presentation. I'm really looking forward to you all. I have seen a lot of really remarkable improvements from my end with Trikafta, so I know that not everybody has benefited as robustly. So I'm really excited to see this Dave's data kind of distilled in a really powerful way. So I'm looking forward to you guys seeing that. So I'll go ahead and hand it over to Dave now. Welcome, Dave.
Thanks, Trey. Thank you. Thanks, Aaron and Trey, for the invitation to be part of your session. It's always an honor to be part of ResearchCon, and thank you all for joining us. I was asked to cover some of the experience we're beginning to understand with Trikafta, particularly in real-world use and beyond some of the registration trials. And a big focus of that probably relates to a study called PROMISE that I was lucky enough to be part of, along with a dozen other investigators who are coming together to study a fairly large group of folks. Some of you may even be in this study. So nearly 500 people who started Trikafta in the US, age 12 and older initially. I want to call out that the average age in the group that I'll describe is 25 years old. For some context, is as to some of the benefits that most people have seen. And I'll be summarizing what we've seen into the first 6 months of use of this drug. So first, please take a look at the legend up above. We did not restrict entry into this real-world study based on lung function or prior modulator use. Blue in these figures will represent people coming into this study and starting their Trikafta by a clinical prescription, not using a modulator. Most of these people have one copy of F508del. Then the green are those on 2 drug modulators. They were typically F508del homozygous, And then there are a group who came in on ivacaftor or Kalydeco, and they, for the most part, were G551D and then an F508del. In way of lung function, not so much focused on the change or improvement, which is what a lot of studies have looked at. I wanted to share with you where people were getting on average 6 months into drug therapy. And you can see really for all three of these groups, again, average age about 25 years old, reaching an FEV1% predicted of nearly 90% or a little better. Sweat chlorides were decreasing as well, even below what we might consider a diagnostic threshold of 60 millimoles per liter for a sweat chloride. And you can see the changes were pretty significant, even in that group who were already on Kalydeco, which is exciting to see. And then how are they feeling? So using their self-reported symptoms for respiratory difficulties or chest symptoms, they improved dramatically. A higher score here is a benefit or fewer symptoms. 100 is a perfect score, which reflects no symptoms over the last couple of weeks. And reaching scores of 90 or better is really remarkable when put in comparison with some other studies. Lastly, by 6 months, we were seeing significant improvement in weight. For a lot of people, this is a benefit. For some, maybe not quite as desirable. You can see, though, for the adults, so 18 and older, reaching BMIs of close to 25, and the adolescents aged 12 to 18, we're seeing significant improvements in their BMI Z-scores, which is encouraging as well. I think it'll be interesting to watch this trend kind of going forward. We were interested, and I think for the sake of this presentation today, how well are people tolerating Trikafta in clinical use here in the U.S.? And so we asked individuals, were they continuing to use Trikafta? They were welcome to stay in the study if they were not. What I can tell you is that over 96% of people who were able to start drug initially have remained in the study through the 6-month time point. So that's a sizable majority. And then 98% of those who were in the study were reporting continued use of Trikafta at 6 months. So this is not universal. Clearly, we need to appreciate that everyone has their own experience here, but a large majority have been able, at least as far as the study goes, to tolerate and continue to use Trikafta, which is encouraging. We can see that in another way too. So the sweat chloride change is pretty dynamic. It's a pretty good reporter of whether or not people are on their highly effective drug. And you can see, as we would expect, big changes in sweat chloride at our first assessment. There on the left, that would be the 1 month change. And then that stayed largely the same through the 6 months. That indicates to us, somewhat indirectly, but suggests that people are continuing to be able to use their Trikafta and adhering to therapy regularly as a whole. So that's encouragement. A couple other observations that might be worth noting for folks today. Again, we actually encouraged participation in this PROMISE study for those who would not fit the eligibility criteria for the studies led by the manufacturer Vertex. So those had lower lung function or higher lung function were welcome in this study, for example. But if we restrict our enrollees in PROMISE to those who would likely have been able to enroll in a Vertex randomized controlled trial of this drug, we actually saw very similar improvements or changes in these outcomes, the lung function and symptoms and sweat chloride. That suggests that in real world use, the drug is working roughly as well as it did in those large trials that were done. And I think that adds to a body of evidence indicating really promising outcomes for a large majority, though albeit not everyone, who starts this drug therapy. And then more data will be published later this year about the microbiology, which is an important focus of CF care and obviously of interest to a lot of people with CF. We have seen significant decreases in the concentration of those common bacteria in sputum samples in this PROMISE study. It'll be exciting to watch going forward too. A common question we get is, well, how do people with more advanced lung disease do if they start drugs like Trikafta? And there was some uncertainty, especially at the very beginning, around whether people with FEV1s that may be lower, say below 40% of predicted, would tolerate starting this drug. There was what was called the purge effect, and some people have difficulty, especially if they're starting at a lower baseline in using Trikafta. I've been pleased to see reports from a number of countries around the world all suggesting reassurance and safety, general safety and tolerability. And often, actually, this group are seeing improvements in their health gains, such as lung function or symptoms that are bigger than those who start drug when they're feeling better and have a higher FEV1. I'll highlight just a couple of those today. So there was a large study that's been done in France, and they continue to report from this study about 250 people who started Kaftrio, they call it there, the same drug, with an FEV1 of below 40% predicted. And they saw on average a 10 to 15 point increase, weight improved, and I think exciting for me, and I'm sure for many of you, fully half fewer were requiring oxygen at home, and they had far less need for IV antibiotic therapy, which of course are important factors in quality of life. In our study, we looked at those who entered on at a point in their disease trajectory where their FEV1 was below 65% of predicted, and compared with those who came in at a higher point where their FEV1 was 90% of predicted or greater. Actually, those on the lower end had bigger changes. Some of that may have to do with the outcome measures, but in general, I think it adds to this concept that those who start Trikafta even later in life or with lower lung function are benefiting significantly, and perhaps those in greatest need of the improvements are seeing that. So we have early, though somewhat cautious optimism about how people with more advanced lung disease can do with these drugs. It is worth pointing out that that damage that has occurred to those lungs over many years is not fully reversed, and this group is not seeing improvements to what is considered normal lung function in the majority of individuals. Lastly, I'll just end by highlighting a number of ongoing studies, and really it's exciting to think about what all we'll learn from this. There are a bunch of great groups around the world looking at these questions. I'm just, for the sake of time, going to highlight a number of studies here in the US. So within this PROMISE program, there's already an active study called PROMISE-PEDS looking at the impact on those who are younger, ages 6 to 11, who are now getting Trikafta drug therapy here in the US, led by a great team of investigators. And we'll be excited to see what they teach us here in the next year or two. And an even younger cohort who is already being studied to collect a lot of important baseline health information before they are believed to gain access to Trikafta if it is approved for use in an even younger age group, and then they'll be followed through after they do so. And thanks to the generosity of the foundation, the PROMISE study overall has been extended. So it's going to be a longer observation period now, up to close to 5 years, to try to understand the impact on other organ systems, say the liver, the GI tract, endocrine factors such as diabetes or bone density, for example, body composition, and then microbiology. So we'll learn a lot more about how people in real world use who get to use this drug and tolerate it, how they're being impacted across a number of organ systems. The manufacturer Vertex also has some large open label studies. So that means that everyone knows they're getting active drug. And I'm sure they're focused in part on long-term safety, which is critically important for all of us, but also they get to measure the durability of these big health gains that have been seen in the studies. And that's exciting. The early results are also encouraging from that work. There's already a randomized trial happening in young children down to age 2, and even early studies of a new modulator combination that would allow people to use this kind of drug therapy once a day rather than twice a day. The foundation is about to launch a large survey to get broader feedback from all of you who may be on Trikafta to better understand the breadth of experience. Obviously, a lot of important focus and work in mental health, trying to understand that for people with CF, and some focus within that, significant focus on the impacts potentially of Trikafta or drugs like this. As you'll see at this conference, obviously a lot of interest and focus on pregnancy, sexual and reproductive health, And then there's a research transplant consortium, also very interested in potential effects of drugs like Trikafta, both before lung transplant and following transplant. And lastly, I'll just mention a number of groups are trying to understand the potential effects of using drugs like Trikafta and other therapies, some of which may be considered more burdensome daily therapies. So we anticipate results starting to come from these even later this year as well. So that's a quick overview. I'm very excited to see the big benefits early and what we'll continue to learn and even some outcomes that are beyond lung function. Trey, I'll turn it back to you. Thanks.
Thanks, Dave. There's so much here, and I think it's just everything that you're touching on is so fascinating. I mean, some of the benefits I've seen, my sweat chloride went from, I was diagnosed at 112, I think, at birth, and after being on Orkambi for 2 years, I think it was, or a year, 2 years, my sweat chloride has still maintained around 110, 112. But after being on Trikafta, I can't remember which study it was. I think it may have been the PROMISE study, actually. But I got, measurements like 1, 3, 6, 9, 12 months, I think. And after I think it was about a year, my sweat chloride had dropped to like 40. And I've heard many other stories about this. And it's just very unbelievable to, have the mutation that I have and have dropped to that point. And then I've also not been able to produce sputum. And so my sputums my throat cultures have been negative, which after having Pseudomonas and several other nasty bacteria, and I know that there's a lot of uncertainty about what that actually means. So I think that is something that I think that the audience would be curious about, because I know it's something I'm very curious about, is what exactly does this mean in your view of like the future of people who have really robusted to this degree of or benefited so robustly to the degree of not like the typical personal metrics of stability or health are now kind of confusing. So what are your thoughts on what this means for this community?
That's great, Trey. It's great to hear, obviously, of your own very positive experience too. There's clearly some uncertainty, which is why there are so many groups trying to better understand both the short-term and long-term effects and a range of health questions, not just those that have been in the first trials.
Right.
Impacts on BMI and overall health related. Do we need to think more about some of the more common health concerns for people in their 50s and 60s? You touched on the sputum and a limitation or inability to collect sputum does raise concerns or questions, at least, around what may or may not be in the lung, and that can impact on decisions about what drugs to use. Right. So I think we'll have to be more creative on ways to try to understand the microbiology in the lower airway, and the groups are definitely working on that. The uncertainty is also an area of excitement. That means that the expected decline, even albeit slower decline that we were seeing before this era of drugs like Trikafta, it's no longer the expected outcome, right? And so that actually leads me to a question for you and those like you. Yeah. How has an experience like this, where you are seeing such improvements in your health and how you feel, how has that changed how you think about the future? Or is it raising any new questions?
Yeah, I think that everybody with CF kind of has this intuitive understanding of mortality. And I think that that's something that we don't really talk about in a social, like in a very like normal sense in our culture. And I think that that's opened up a lot of questions for people who are, in their 20s, 30s, 40s, who are benefiting so robustly. They're seeing stability and opening questions. There's opportunities for full-time employment for a lot of people who have not seen that opportunity. And there's a lot of questions about how do we make that a more a smoother transition for people who haven't had these opportunities, either because they've been unable to work. And for me personally, it's forced me to really treat myself with a lot of grace, to ask myself how do I approach these things in a way that I'm not trying to compare myself to my peers in their 20s and 30s as well. And it has dramatically shifted how I view the future. I mean, I'm pretty open about this now. I hadn't really planned for retirement. There are a lot of rules with pulling out early and things like that. And that's something I hadn't really assumed I'd ever see, and that's a kind of dark thing. But I think that in my world, I try really hard not to view things as either just purely good or bad. And so with Trikafta, I feel very strongly about how I've seen this newfound life that I never really expected, and that's an incredible thing. But it's opening up questions that I'd never really, I may have considered, but very, very, very superficially. And so it's really affected how I view the future, and it's also affected how I go about talking about these things, not just from a person with CF perspective, but also just disability in general and other people with chronic diseases and things like that. And so my point about the whole not viewing things as just positive or negative, I think is something that has helped me a lot, because it's allowed me to shift this belief that I have to celebrate something 100% of the time. And I view it very much like exercise. If you go run 15 miles every single day without any rest, it will eventually hurt you. You'll eventually tear your body apart. And I think that if something like exercise, which has so many benefits, can eventually be negative in some degree, then I think that it's possible to view something like Trikafta in the same sense. And that's helped me a lot with thinking about my sister. My sister, she passed away a year and a half before Trikafta was approved, but she had gotten her first transplant 6 years before. So there was never really an opportunity for my sister to have access to modulators. So I often think about how to celebrate it for myself and celebrate it in the sense that I know my sister would be really excited for me and for the CF community in general, but also recognize that there's something deeper there and something more sensitive, more spiritual, something more, I guess, bigger picture to consider. And so that's why I was very, very privileged to be a part of this session. So I think the fact of the matter is that there are a lot of people who have benefited, but it's opened up questions in ways that we hadn't really anticipated. And I also think that there are a lot of people who have seen some negative effects. So making sure we're having honest conversations and making sure that these conversations allow people to think about their decision making in a way that doesn't put some undue burden on feeling like something has to be celebrated purely, and can recognize the sort of both sides of it. So again, total honor to be a part of this. Thank you, Dave, for your presentation. We'll now have Johnny Grant and Erin to go through some of the adverse effects, and to have Erin share her side of the story. Thank you guys so much for allowing me to be a part of this. It's been an honor.
Yeah, thanks, Trey. Thank you.
Of course.
Thank you, Dave. Thank you, Trey. So before I jump into my Trikafta experience, I'd like to give a little background about my CF journey in general. Most of my life, CF wreaked havoc on my GI more than my lungs. And my pancreas functioned, and therefore I experienced chronic acute pancreatitis that just would not stop. And by 2008, I was surviving on TPN and a morphine pump. And the decision was made to have a distal pancreatectomy, where they removed part of it and then transplanted part of it into my abdomen to try to keep me from being a fragile diabetic. And unfortunately, I had a lot of complications and ended up septic, multi-organ failure, nearly weeks in a coma on a ventilator, trach, and ileostomy. It was a very big deal. It was very life-changing. And being on the ventilator for such an extended period of time, I developed acute respiratory distress syndrome, and that really took a toll on my lung function. And going into this surgery, my lungs were fairly stable, between 70s and 80s for my PFT. And when this was all said and done, it was in the teens, and it took lots of time to recover. But I was able to get into like the low 40s, and that was great. But then I needed, nighttime oxygen. And then 4 years ago, I required continuous oxygen. And I required a lot of surgeries to correct all of the damage from that surgery. And it's not been easy. But in all of this, I got surprising news in December of 2020, just in time for Christmas, and that was that I would get to try Trikafta, which we did not think was going to be a possibility because two rare mutations. So it was within days of starting that I immediately noticed that I was less short of breath. I have a very high heart rate at rest, and it gets higher when I'm moving, and those all decreased. Um, I started gaining weight. My lung function stabilized. I've always had the last several years home baseline and a hospital baseline. If I'm on antibiotics in the hospital, I can hit high 30s, maybe a 40 here and there. But at home, as soon as I'm off antibiotics, I'm down in the 20s. And it's very frustrating. And having Trikafta, I suddenly had energy. I could do things that I wanted to do. I could put effort into things I wanted to do. And my husband noticed this because, you know, basically been in survival mode for a very long time, you know, doing long admissions, coming home, hoping for a little time at home, for some normalcy, only to know that I have to go back for another long admission. And I was also able to stay out of the hospital for the longest period of time than I've been able to in over 15 years. And all of that was very exciting. And I really, you know, struggled when we realized that the side effects were getting to me, that they were very aggressive. And it was, you know, kind of hard to determine. Everything kind of got lumped under the Trikafta umbrella of side effects. And because there was no data for me as, you know, an outlier, rare mutation, you know, everything goes in the pot. And before we jump into all of my side effects, Johnny's going to come on and give some background on Trikafta. And then he and I are going to start discussing the side effects. And Johnny is a BCACP clinical coordinator, pharmacist for Johns Hopkins home care group. So your turn, Johnny.
Thank you, Erin, and I want to just thank you again, Erin, for your bravery and your transparency and sharing your journey. And I really hope, and I am I think that this is going to help a lot of people, and so I'm excited. So I wanted to start before we talk about adverse reactions and side effects and things. I really wanted to just explain and take a step back and simply explain how Trikafta works and what it does. And so I want to start with this picture here. So this is a super zoomed in view of the CFTR protein. So in people with CF, CF is the issue is that this CFTR protein is either not there or is malfunctioning, or it doesn't work. So you can see on the left here, you can see how this is a functioning CFTR protein, and its job is one job to simplify things is to send chloride ions from inside of a cell to outside. And by doing that, water will follow those chloride ions and will have a good balance. But in cystic fibrosis, that CFTR protein, or the door, is either locked or is not there, or there's some malfunction there, and the chloride and the water are stuck primarily inside the cell. And that means that outside of the cell, here on the right, things are going to be a lot drier. So that's where the thick mucus and the thick sticky mucus and stuff comes from. So my favorite analogy that I use with patients is the analogy of a door. So think about yourself being in a room right now, and think of yourself as the chloride ion. And the only way that you get out of the room that you're in right now is through a door. But in CF, door is not there. And so based on what your mutation is, you may have a door that's just locked and you don't have the key to open it. You may have a mutation that makes it so that you have all the raw materials for a door in the room with you. So you may have like a door frame and a doorknob and stuff in the room, right with you on the floor. But what good is that if it's not there on the door, not there on the wall, functioning as a door? And so this is the problem with CF, and with the CFTR modulators, they work by helping fix that door problem that you may have. And so as we go to our next slide here, Trikafta is, or elexacaftor, tezacaftor, ivacaftor, is a combination of 3 drugs. So 2 of them, elexacaftor and tezacaftor, are basically door makers. So what they do is that they help your body make that CFTR protein g- get there on the cell surface, or get there on the wall. So for the F508 del mutation, for example, it helps um, take the raw materials of the door that are in the room, so the doorknob, the hinges, the frame, and it basically works on it and puts it all together and puts it on the door, on the wall. And not only that, but it helps to maximize. So by having 2 door makers, so by having elexacaftor and tezacaftor, you can actually get 3 or 4 or 5 doors on the walls in the room that will help you to have more normal function than just to have like 1 door on the wall. But that's what your door makers do. And then the third drug in Trikafta is ivacaftor, and this is your door opener. And this guy, once the doors are there on the wall, it just holds it open. And that will allow you, the chloride ion, to walk out and the water to follow, and you will then restore balance. And so that's key, because as we talk about some of the adverse events and side effects and all these changes that we can see, we're going to see how this CFTR, once you turn it on, it affects a lot of things. So you don't just have these CFTR proteins in your lungs; they are literally all throughout your body, and they are critical, and they have functionality in almost all of your body's systems. So a lot of these side effects may be linked to the change in you not having CFTR function, or poor CFTR function before, to now having much better CFTR function, and what that looks like. Like your body has to readjust, or I'm going to say this time and time again today, recalibrate. It's kind of like when you're buffering or something, and it's like the little spinning window, recalibrating, buffering. Like that's what your body is doing when you turn on that CFTR protein. Your body has to adjust, and a lot of the side effects can come from that. And so some of the published um, adverse events, or common adverse events associated with Trikafta, are seen here on the screen, and we're going to touch on a few of these. Erin's going to share some of her story, but these are some of the common ones that we'll see. So one thing that we're going to monitor for are going to be your liver enzymes, because in the trials, some patients had elevated liver enzymes, so we have to watch that. You can have abdominal pain, or diarrhea. Headache was common in some patients as well. In terms of respiratory, this one I kind of want to put with an asterisk. So we've talked about the purge recently, but when you turn on that CFTR protein and you start to hydrate the airways and the nasal passages, you may have the purge, or a runny nose, or cough up a lot of mucus and phlegm, or things that have been stuck inside of you for so long. So that is where you can see these side effects of a respiratory tract infection or nasal congestion. We're going to talk about some of the rashes, and particularly how they're seen at a higher prevalence in females versus males. And then some other interesting ones as well that we're seeing in the studies: increases in blood pressure, um, a loss of dysmenorrhea, and hypoglycemia. And so these are some of the common known adverse reactions with Trikafta that have been noted in the previous studies. So we do want to have in the background, if we can, If you can share some of your challenges or adverse events that you've experienced while you were taking Trikafta, if applicable, and we'll come back and look at these towards the end of our discussion, along with the positives as well, and go from there. So hopefully that will help us as we talk and lay through the table of what to expect with our Trikafta, how Trikafta works, and how that may be linked with some of the side effects that we see and experience. Um, and so I wanted to bring Erin back, and let's talk about some of your journey.
All right. So the first thing right off the bat, it was within a week of starting. I had a hysterectomy several years ago, and so I'm on hormone replacement therapy. And we do the depot shot because I have problems with other ones and absorption issues because of all my GI stuff. And it totally blew it out of my system. Like, worst hot flashing I think I've ever had in my life. It was really troublesome, and that required an additional dose to kind of help that situation. And then the greasy hairs started. I started losing my hair, and my face started breaking out. And it was like aggressive cystic acne all over my chin. It was very painful. And it took a lot to try to manage it. It was very aggressive. And then I also got the rash. And that came on slowly and lasted about 2 weeks before it resolved. And so we had some good points on why these things might happen for other female patients on Trikafta.
Okay. Well, so let me just pause in and jump in really fast, and I wanted to talk about some of the hormone issues that you had, and how hormones and fertility have been affected with Trikafta. If I can, then we'll jump back into your side effects that you've experienced, and go on from there as well. So one big thing that we've seen with Trikafta has been an increase in fertility among women. And so by this a slide here, which was published by Dr. Taylor Kauser, we can see that the prevalence of pregnancies has increased dramatically since Trikafta has been approved. And you can see where Kalydeco, Orkambi, and Symdeko were also started as well. But we've seen this just explosion since Trikafta has been approved. And Dr. Taylor Kauser also had a nice picture here that talks about and discusses the impact of CFTR on the reproductive tract. So the CFTR is expressed throughout the entire female endocrine system, including in the uterine cervix, the fallopian tubes, and the endometrium, and in the ovaries. And another factor that may also play into infertility in some women with CF is malnutrition, which we know that with pancreatic insufficiency, it can be hard for people with CF to get in all of the nutrients that they need. And so when Trikafta is started and we turn on that CFTR protein, as I said before, and you have all that involvement in the female reproductive tract, we have seen some changes that has resulted in an increased amount of pregnancies. And so one important thing, if you are a female who is going to start Trikafta, or who is on Trikafta, and you're not looking to get pregnant at this time, you need to prioritize and make sure that you discuss with your care team contraceptive methods, and what you want to do for preventing pregnancies. And so one of the theories, and so by starting Trikafta, one of the main theories out there is that it thins the cervical mucus, and so in people who have CF, um, and women with CF, they may have thick cervical mucus, and so once we turn on that CFTR, some women with CF may have a purge down there as well. So not just in your lungs, but also down there, and that may make it easier for them to conceive and to get pregnant. But it can also affect the hormone levels as well, because CFTR um, can have an effect on testosterone and estrogen levels in the blood. So that was one thing I wanted to share with you all. But definitely make sure that you discuss with your care team that, because I believe approximately 50% or about half of the pregnancies were not planned or expected. And so it's one of those things that we've seen in our practice, those who were previously infertile be able to conceive and to have and to have children, which has been wonderful. But then there has also been those, how do we get here type of situations as well. So I just wanted to kind of park it there for just 1 second and review that, and then I wanted to jump back and talk more about some of your side effects, Aaron.
All right. So then we had fevers for a month. My GI motility slowed even further. I already have a very extensive regimen to keep things moving, and we really had to step that up. I also experienced muscle fatigue and like a weighted limb syndrome, sensation, and it was more than just that my body was severely out of shape after being so sick for so long. And then the two that ultimately made my decision for stopping Trikafta for the time, and it was unrelated to the rash, but my whole body itched, my clothes bothered me, everything bothered me. There was no getting around it. I just wanted to peel my skin off every day, all day. And then I started having nerve pain. It was a burning sensation that was all over my scalp, down my neck, across my shoulders, down my spine. We tried many different medications to try to get both of these under control, and nothing was helping. And we had a lot of, my team and I had a lot of hard conversations trying to suss out, what this could be, because, they hadn't experienced it with other patients, and, they were doing their best to try to figure it out. But ultimately, we felt that stopping it and seeing if we could get to the bottom of it would be more beneficial. So it wasn't easy,
Yeah.
and we tried for months. We even lowered my Trikafta dose slowly, where fortunately we learned that even on a low dose of Trikafta, I was still receiving positive benefits, but it still wasn't alleviating the more troublesome things.
Okay. And remind me, you when you first started Trikafta, you did or did not experience the purge.
I did not have the purge.
Okay.
We think maybe the fevers were kind of my purge, that I struggle to cough things up as it is, so I wasn't getting anything extra up at the time, but I did have fevers for an entire month.
Yeah, well, so that's a very a common thing as well, and a misconception that can be out there is that, like, if you don't experience the purge, then the medication isn't working or that there's an issue. Everybody's experience with Trikafta is going to be unique to that individual. It doesn't mean that it's not working or it's not working the same, but we all have different medical histories, different combinations of mutations, and different backgrounds. And so some people have the purge and some don't. Some have a huge increase in their lung function initially, and some don't. And so it can really vary. But one of the things that we have seen is that we can see either a slight increase in your lung function, and or we can also see stability, which is one of the greatest benefits of these CFTR modulators, is that we can keep you at your current lung function, or um, your lung function longer, which we can fight the eventual decline in lung function that can lead to a mortality or lung transplant as well. So that's a huge benefit, but like it doesn't always look the same way for everyone.
Right.
The fact that you had experienced the fevers, and that may have been kind of in place of the in place, or like your way of experiencing that type of purge. So remember when we talked about turning on that CFTR protein? Um, if you have advanced lung disease, which is another thing as well, with advanced lung disease, Trikafta cannot reverse necessarily the damage that has been done over years and years. And so if you are now hydrating those airways or hydrating some of those pockets, um, you may be stirring up, and your body may be trying to cough up and get rid of what is in your lungs and what's in there, but it may be having trouble getting rid of it. But your body sees that, hey, here's this bacteria or here's this infection that has been kind of hiding here, and I see it. So one of the ways that our body fights things is through fevers and inflammations and things like that. So um, that is one thing that we could have seen there. But you want to make sure that before you start Trikafta, um, or as you're on it, you set and you have realistic expectations with your care team about what to expect, and know that what someone else has experienced may not necessarily be what you experience, because we all have different backgrounds. And so um, especially if you have advanced lung disease, you may not see a 10 to 14% increase in your lung function because of the extensive damage that had been done before. And so, but you may see an increase of 1% or 2% or none, but you're stable and you're staying right there at about 35 or 40, or wherever like you may have been, which is also a benefit because we're not, we're not going down, right? And you're staying stable. So
Exactly.
um, yeah, and so that was there. I wanted to also talk about again the recalibration aspect. So your body, your skin is adjusting to the new sweat chloride levels as well. And so you shared how you were experiencing some acne again, and with the challenges that you had, um, that could also be your body kind of recalibrating and adjusting to what your new normal is now, because your normal for 30 something years of your life has been CF with high levels of chloride in your sweat. Um, and so, and that can take time for it to readjust. The other thing as well that we also have to consider is drug interactions.
Yes.
And with a lot of these adverse events that you experienced, um, with adverse reactions, it's hard to know, is it specifically from Trikafta, or is this from something else that you're on and there's a drug interaction? Is it because of something else that you're on, and now that you've turned on your CFTR protein, is that re-affecting or affecting how another bodily system is processing? So I know how were your migraines or the burning sensations affected?
So having stopped Trikafta, it my symptoms didn't resolve. So like everything we assumed was Trikafta, especially the big problems, they weren't resolving. And it came out that I get Botox for my migraines. I've been on it for 12 years. Um, but several months prior to starting Trikafta, they increased my dosing. And once we got the itching, like allergy thing under control, I was able to realize that the burning sensation was everywhere that they injected my Botox. So that means more Botox for migraines, and we're currently in the process of finding a new treatment plan. And hopefully, I will be able to restart Trikafta once we have a solid plan going, so that way we can discern between Trikafta and new migraine treatment.
Awesome. Yes, that's a really important thing there as well, and why like you really have to partner with your care team, and also possibly partner with other specialists as well to find out what the root cause is, because it may not always be as easy as, oh, I started Trikafta and then this happened, so this must
Yeah.
be from Trikafta. And I think that's a big thing that we should explore, that you should be exploring with your care team. And so I know that we're running against the time window, so I wanted to just touch on a few other things as well. So let me get this up again. And so I just wanted to share as well. So there are case reports that have been published. So these are case reports are a detailed report of the diagnosis, treatment, and follow up of individual patients, or people that were like interesting cases. So we saw something that wasn't really in the package insert, that was an expected adverse event. And so here on this screen are a few that have been published recently, in the last few years about Trikafta specifically. Some of them are just one patient alone. Some of them are a combination of multiple centers with a few patients. But it does help us. These do help us, so that if we do have someone who we see that is experiencing something, we can see how else was this experienced by someone else? How did they treat it, or what was done, until it is researched further, which brings me to my next slides. Um, it is important that we report the side effects or the adverse events that we experience. And one way that we do that is through the FDA's adverse event reporting system. And so I have a screenshot here that shows the amount of adverse events that were reported for Trikafta since it has come out. But it does have a lot of limitations. So it looks like it's a lot on the slide, but there can be lots of duplicates and incomplete reports on that dashboard. Um, the the existence of a report on this form does not mean that Trikafta necessarily caused it. Um, and these are reports that have not been verified per se. Um, and the rates of occurrence, how frequently they have occurred, is not really going to be captured here. But this is something that if we're seeing it enough, if enough people are reporting it and sharing, hey, I'm having mental fogginess, or I'm having this, or I'm having this weird side effect, that's how we can let the FDA know, and also let the pharmaceutical companies know as well. Um, and so I also have this slide here as well, so that you can know how you can report uh, adverse events that you are experiencing. So you can report them through the Consumer Compliant Reporting System, and through MetWatch through the FDA. And you can also report them directly to Vertex Pharmaceuticals if you are on Trikafta. You can also report them to your Vertex GPS representative as well if you are enrolled in that program. And we do have all this spelled out for you in the research kind of resource page as well. And so I just wanted to run through those, and then bring everyone back, so that we can discuss this. But the most important thing is discuss these adverse events with your care team, so that they can navigate through this with you, and they can also report these adverse events as well, because they have to provide, or we have to provide more details that goes into that. All right. Sorry, that was a lot of information and not a lot of time.
Yeah, thank you so much, Johnny and Aaron. That was really, really, really helpful, and just want to thank you both again, because thank you, Aaron, for sharing your story, and Johnny for addressing some really just critical questions that I know are pretty prominent in a lot of people's minds. So we only have about 10 minutes, and so we got several questions, and a couple of them ask similar. There's kind of some similarities, so I think to make sure we get uh, the most covered in the shortest amount of time, we'll kind of group them and try to address them all, but in shorter terms. Unfortunately, we can't commit that much more time. So we were asked a question about whether or not kidney stones are more frequent in patients on Trikafta, as well as someone asked a question, let me see, about whether or not Trikafta has been seen to have any effects on the eyes. So if Dave or Johnny, if one of you could address the whether or not you've seen higher rates of kidney stones in Trikafta patients, or any issues with the eyes.
Sure.
Go ahead, Johnny.
Sure. Yeah. So in my practice and in my experience, we have not seen an uptick in kidney stones. Um, and I also so I work with the adult clinic at Johns Hopkins, and we do not see a lot of eye issues with Trikafta. It is a labeled warning for pediatric patients that they should receive at least annual eye exams and an eye exam at baseline for cataracts. But we do not see them routinely as much in the adult population.
Yeah, I would say the same. I've not seen an increase in kidney stones. I work with a pediatric population in Seattle. But CFTR, that protein that Johnny covered so nicely, that is present in the kidney, and I think it's important to monitor for that, as was described. There's rationale why there could be an issue there, perhaps even an improvement, though, in certain kinds of kidney stones that may be less prevalent. That would be our hope. And the monitoring in the pediatric and adolescent group for cataracts, absolutely recommended, though I've not seen that as an issue in clinical use of Trikafta thus far. That warning and need came mostly out of animal studies that were done before the drug was approved.
Fascinating. Yeah, Aaron has Aaron will ask the next question, but to that point, I wish we could spend another hour discussing how to actually investigate, like how the clinical trial system and the animal studies work together to investigating these types of mechanisms as well. That would be another great session. So, all right, Aaron, go ahead.
All right. So we got two questions asking more about mental fogginess and how common that is, and how people determined they were experiencing it, as well as if there is anything being done or any studies into Trikafta's mental and neurological side effects.
All right, so I can take the first crack at this, and then and I'll pass it over to Dave as well. But so in terms of the mental fogginess, I am hearing this here and there. I wouldn't say with the majority of patients, but I am hearing it probably from a good handful or so. And so it's one of those things where we're managing it, one by finding out if there is another root cause, right? So like if there are any other factors that may be contributing to this, we are potentially looking at adjusting their Trikafta dose or the timing. So sometimes something as simple as changing when you are taking your Trikafta, or possibly flipping your doses has helped some patients. And if that works, I am ecstatic about that, because it's the same outcome in terms, but just with better tolerability. But what it has looked like, some patients have shared with me that it's kind of like they may be a bit more forgetful with like what is going on, or like what they were doing, they can have trouble focusing or concentrating. And so it definitely is something that we do want to learn more about. There was a paper that talked about how ivacaftor may potentially have or have some serotonergic effects, which some of the antidepressants and some of the medications that work with with depression work on serotonin. And so there's still a lot that we're learning, and we do have a mental health subgroup that is that will be looking at this and things like it more prevalently as well. I think in CF, the other factor too is that the population also has a higher incidence of depression and anxiety as at baseline as well, with it being a chronic disease. And so, and then again, with the whole recalibration thing, it's everywhere. So that's, I think those are most of the questions.
Yeah, that was great, Johnny. I would just add, this is probably an example of where it can be tricky, challenging to decipher what's happening with mental health, and is it related to Trikafta, and if so, is that a direct drug response or is that an indirect effect, kind of related to what Trey talked about earlier, new questions in life and a lot on your plate, and the fact that at least in the U.S. this clinical use of Trikafta overlapped with the pandemic, and might that have some impact here? But I will say the stories that I have heard, though they've not been often, the ones I've heard are compelling. And this has, I think, brought this to the forefront, a top priority for researchers in the community and mental health experts and neurobiologists coming together now to try to get to the bottom of this. It's an important question for all of us.
Yeah, I often think about how, environment versus nature versus nurture, and I think that environment has just a tremendous impact on how we process the world, and having a chronic disease is not just the physical and the components, but also how having a chronic disease fits into the broader aspect of the world. Do you guys think we have time for one more question? I think this session ends in 3 minutes, and I think we have a little bit more to address, right, Erin? You have a closing script? Yeah, so I don't think we have enough time for one more question, unfortunately, folks, but so I'll go ahead and hand it over to Erin to finish us off. Thank you all so much.
Thank you, gentlemen. So we're out of time, and I'm going to go ahead and wrap this up. Thank you to all of our speakers for sharing your knowledge and insight about Trikafta experiences. And thanks to all of you for your attention and your questions. There are many wonderful resources related to all of the event sessions on the resource page. For this session, you'll find the slides we shared and other items the speakers thought you might find valuable, which includes how to report adverse events. Please spend some time exploring the resources and download anything you want to keep. We now have expo booths and networking sessions open for the next 45 minutes. In the expo, you can visit the CF Foundation staff to learn about a number of foundation research initiatives, or visit one of the two Meet the Speakers booths, where you can interact with Dr. Raksha Jan and Melissa Schiffman from the Is It My Age or Is It CF session, or respiratory therapist Shinan Pai and Lathronia Jefferson from the session on managing daily care titled Let's Build the Future of Daily Care Together. If you are more interested in meeting other ResearchCon attendees, visit Networking, which is a fun feature that allows you to connect others and get randomly matched with another attendee for a 5-minute video conference. This attendee could be a clinician, CF community member, researcher, or CF Foundation staff member. You never know who you'll get matched with. Thank you again for coming to learn about Trikafta experiences, keeping it real world. We hope to see you at the closing keynote about genetic therapies on the horizons, which begins in about 45 minutes at 3:15. And we also have one more thing with the Mentimeter, and that is our word cloud. And you are able to put in 4 words or less about your experience.
That pretty much captures it in a word cloud as the expansive experiences. So thank you all so much, and I think it's time to close this out. This was truly an honor. Thank you all to my co-host and the other speakers, and thank you all to the attendees and the comments and the great questions.
Thank you.
Thanks, everyone.